Calcium, second lecture. In previous lecture, we already discussed dietary calcium sources, the recommended daily allowances, body distribution, forms of serum calcium, absorption of calcium, and factors that affects calcium absorption. Today we begin from calcium homeostasis. At low serum calcium, parathyroid hormone release and increase the intestinal absorption of calcium in intestine. In bones, it mobilizes bone calcium and increase the bone reabsorption and cause a marked hypercalcemia. In kidney, parathyroid hormone increase the kidney absorption from distal convoluted tubules and allow to keep the calcium level elevated. At high serum calcium, calcitonin produced by parafollicular cells of thyroid gland. In intestine, it decreases the intestinal absorption of calcium. Calcitonin decrease the bone resorption means decrease mobilization of bone calcium and increase the deposition of calcium in bones. In kidney, it increase the urinary loss of by inhibiting the calcium reabsorption in proximal convoluted tubules. Now the excretion of calcium. Average turnover of calcium daily 1240 milligrams calcium enter into the gut. Out of that, 1000 milligrams obtained from dietary sources and 240 milligrams from blood. Net absorption per day is 240 milligrams. 760 milligrams calcium per day eliminate from feces that represents the unabsorbed dietary calcium. 6000 milligrams calcium filtered by glomeruli and most of it is reabsorbed. Normally, kidney excreted only 24 milligrams calcium per day that represents the renal excretion of calcium. Negligible amount of calcium is lost from skin, but in excessive sweating, calcium lost more. In pregnancy and lactation, a significant loss of calcium is absorbed that represents a loss of mother's calcium. Calcium toxicity. An excessive intake of calcium can be dangerous because calcium gets deposited in various body tissues resulting in malfunctioning. Calcium toxicity producing hypercalcemia, nephro- nephrocalcinosis, renal failure, and hypertension. Now, calcium balance. Differences between the calcium ingested and lost from the body over a period of time. Calcium positive balance conditions are growth, hyperpituitarism, hyperparathyroidism, hyperthyroidism, pregnancy, calcium intake after a long period of calcium deprivation, and the conditions that are associated with a negative calcium balance. That includes rickets and osteomalacia, less absorption or malabsorption, especially in sprue disease, hypoparathyroidism, hypothyroidism, decreased levels seen in starvation, decreased calcium intake, and deficiency of both sex hormones. In both sexes. especially in old age. Now, the biochemical functions of calcium. Number one, in calcification of bones and teeth. Process of formation of bones and teeth is called calcification. The calcium utilized and mineralization occurs in osteoblastic activity. Number two, clotting of blood needs calcium ions. Blood clotting needs calcium ions. Calcium acts as a factor 4 in blood coagulation cascades. Prothrombin contains a gamma carboxyglutamate residues, where calcium chelated during the thrombin formation. Number 3. Excitability of nerves. Calcium is necessary for transmission of nerve impulses from presynaptic region to postsynaptic region. Number 4. Calcium ions act as cofactors or activators of certain enzymes. Calmodulin. Calmodulin are calcium binding regulatory proteins that are identical to troponin C. At least 4 calcium ions bind with each calmodulin that leads to the conformational changes that cause activation of certain calcium dependent enzymes like adenylate kinase, protein kinase, calcium magnesium ATPase, myosin kinase, phospholipase C, phosphoryl kinase, pyruvate carboxylase, pyruvate dehydrogenase, and pyruvate kinases. Number 5. Role of calcium in muscle contraction. Role of calcium in muscle fibers. Calcium activates ATPase, increases reactions of actin and myosin, and facilitates the contraction coupling. Calcium causes the inactive myosin kinases into active myosin kinases after calcium interacted with troponin C that triggers the muscle contraction. Increased plasma calcium causes the decreased conduction of heart impulses and thus causes heart block. Number 6. Responsible for initiating contraction in vascular and other smooth muscles. Calcium ions are responsible for initiating the contraction in vascular and other smooth muscles. Calcium ions enter through specific channels, just as in the case with cardiac muscles. Drugs which block these channels, called calcium channel blockers, decrease the contractility of cardiac and arteriolar smooth muscle as well as the conduction of cardiac impulses within the heart. These drugs find use in the treatment of angina pectoris, cardiac arrhythmias, and hypertension. Number 7. Role in maintaining the integrity of capillary wall as well as the mucosal membrane and cell adhesion. Calcium is essential for maintaining the integrity of capillary wall. In its deficiency, capillaries wall become fragile and there is an increased permeability of capillaries. Calcium ion in a similar way it has a role in maintaining the integrity of mucosal membranes and cell adhesions. Permeability of serum through capillaries decreased by calcium, thus calcium is clinically used to treat the allergic reaction. Number 8. Role in exocytosis and role in stimulus secretion. Intracytosolic free calcium level is about 1 by 10,000s of calcium ions in the blood and excess cellular fluid. This steep chemical gradient produces a rapid calcium influx through a various membrane channels after being activated by hormones, metabolites, and neurotransmitters. Due to these properties, calcium ions are involved in exocytosis and thus have an important role in stimulus secretion coupling in most exocrine and endocrine glands. For example, the release of catecholamines from adrenal medulla, release of neurotransmitters as at synapses, and release of histamine from mast cells is dependent on calcium ions. Some of the hormone exerts their influence through calcium ions. For example, the effect of adrenaline on the liver cells to induce glycogenolysis is partially due to the calcium ions within in these cells. Voltage number 9. Voltage regulated calcium channels. Calcium ions exerts profound effect on excitable tissues, that is, muscles, cardiac and smooth and nerve cells. Calcium ions enter into these cells is regulated by charges in their membrane, that is, membrane voltage or potential exerts. For this reason, channels through which the calcium ions enter into these cellular interiors is called voltage regulated calcium channels. Now, clinical condition. Two conditions mainly called hypercalcemia and hypocalcemia. Hypercalcemia, the major cause of primary hyperparathyroidism, especially common cause of OBD patient. Primary hyperparathyroidism further associated with familial hyperparathyroidism and ectopic hyperparathyroidism. In familial hyperparathyroidism associated with hyperplasia, tumors, solitary adenoma, multiple adenoma, and parathyroid carcinoma. And ectopic hyperparathyroidism associated with multiple endocrine neoplasia type 1, which associated with pituitary and pancreatic carcinoma, and multiple endocrine neoplasia type 2, which associated with medullary carcinoma of thyroid. Malignancy. Hypercalcemia in malignancies may be due to a humoral factor or hematological factors. In humoral, no direct skeletal involvement that may be due to a parathyroid hormone related proteins, growth factors, tumor growth factors, epidermal growth factors, platelet derived growth factors, and in direct skeleton involvement by these tumors due to a direct erosion of bones by tumors or production of prostaglandin E2 by tumors which can produce bone resorption. Hematological malignancies associated with cytokines, tumor necrotic factors, and calcitriol by lymphomas. Other endocrine causes includes hyperthyroidism, acromegaly, acute adrenal insufficiency, etc. Overdoses of vitamins. In hypervitaminosis D and vitamin A intoxication, hypercalcemia occurs. Drug-induced hypercalcemia includes thiazides and diuretics. Increased serum proteins, hyperalbuminemia and hyperglobulinemia. Renal failure. Renal failure associated with acute renal failure, chronic renal failure, and post-renal transplantation that causes hypercalcemia. And now hypocalcemia. The commonest cause of hypocalcemia, hypoalbuminemia, followed by renal failure. Reduction in serum albumin, hypoalbuminemia, associated with malnutrition, malabsorption state, nephrotic syndrome, chronic renal failure, chronic liver diseases, and protein losing enteropathy. Hypothyroidism. Hypo- hypothyroidism may causes hypocalcemia due to a surgical induction seen in 90% cases. Idiopathic may be due to a autoimmune bioinactive parathyroid hormone and transient hypothyroidism of infants. Renal diseases and renal failure associated with renal tubular dysfunction, associated with a tubular necrosis, and associated with a chronic renal failure. Hypoparathyroidism. Hypoparathyroidism associated with other diseases includes Addison disease, pernicious anemia, and fungal diseases like candidiasis. Miscellaneous causes. Other miscellaneous causes include acute pancreatitis, rickets and osteomalacia due to vitamin D deficiency, medullary carcinoma of thyroid, and magnesium deficiency. Neonatal hypocalcemia is due to immature parathyroid hormone. That's all about calcium.